So now I'll leave you with Dr. Alfredo MenaLora, Medical Director for Infectious Control at St. Anthony's Hospital. Thank you.
Hello, everybody, and thank you so much for your time. My name is Alfredo MenaLora. I'm an infectious disease physician. I work at St. Anthony Hospital, where I've been seeing patients and working on COVID-19 response. And first, I want to thank our health commissioner and our mayor for all of their leadership and all of their work throughout this pandemic. And I want to thank you at home as well for staying safe, wearing your masks, and all the sacrifices you have done as well. I want to bring to light my clinical perspective and that of my colleagues seeing patients with COVID-19. And I think my most important message is COVID-19 remains very dangerous. Though patients and family members who are older of age are more likely to develop severe disease can happen in people of all ages. I've seen patients in their 50s with severe disease, patients in their 40s, 30s, and yes, even in their 20s. So with that, I want to remind you that this could be any one of your family members or neighbors, and in fact, it can be you, regardless of age. And this brings me to another point. About 40% of patients do not have symptoms at all, and this means they may spread the disease to others who eventually will develop symptoms and can develop severe disease. This too can be you or anybody around you. And that's why our mitigating efforts are so important. Wearing a mask, staying apart, socially distancing, and as we move into the holiday season, making sure that we celebrate Thanksgiving in a different way with our nuclear family, protecting others around us. This is why mitigation is so important, because it can be any one of us, and any one of us can also spread it easily to others. And it matters. As more cases come up, more hospitalizations, and tragically, more fatalities as well, more deaths. For us in the healthcare systems, as we see more cases, there are less beds, and healthcare systems can certainly become a little bit tighter in how we can respond. For healthcare workers, it's been a year of a lot of work. And this work is not just physical, it's emotional. We are there with the patients as they are critically ill, and try to be there with the family members as well. So there is a light at the end of the tunnel, as my colleagues were saying. There is a vaccine in the horizon, but we remain in the tunnel. And therefore, it is important for us to mitigate these risks as much as possible. In the months ahead, it will take months for these vaccines to reach all of us. And until then, we have to stay safe and stay strong. Throughout this year, I've been reminded of a poem by Carl Sandburg of Chicago, in which he describes the city as stormy, husky, brawling, city of big shoulders. Come and show me another city with lifted heads, singing so proud to be alive, coarse, strong, and cunning. These broad shoulders of the city are made of people like you, who are doing the right thing, making all the sacrifices. So please stay strong and stay safe. And with that, I want to also say my message in Spanish a mis colegas latinos en la ciudad. Yo soy el doctor MenaLora y soy un especialista en enfermedades infecciosas. Y mi mensaje hoy es sobre la vista clínica de cómo COVID-19 se ve en los hospitales. Estamos viendo pacientes con enfermedad severa. COVID-19 sigue siendo bastante peligroso. Tenemos pacientes de todas las edades. Los pacientes de mayor edad tienen más riesgo a tener enfermedad severa, pero hemos visto pacientes con 50, 40, 30, 20 años de edad. Y ese puede ser cualquiera de ustedes. Puede ser su vecino, puede ser sus familiares, puede ser usted. Y por igual hay muchos pacientes, aproximadamente un 40%, que no tienen síntomas. Y esas personas pueden transmitir el virus a personas que sí pueden progresar a enfermedad severa. Por eso es tan importante este Día de Acción de Gracias, de tratar de mantener nuestra mitigación usando máscaras y tratando de celebrar estas festividades dentro de su familia nuclear. Mientras más pacientes hay, mientras más transmisión hay, más casos, más hospitalizaciones y lamentablemente también más muertes. Pero podemos mitigar esto con todas las cosas que hemos estado hablando: máscaras y distanciamiento social. Hay una vacuna, hay varias vacunas que tienen muy buena efectividad en la información preliminar y todos estamos esperando que esa vacuna llegue. Y lo que siempre digo es que hay una luz al final del túnel, pero aún estamos en el túnel. Cuando llegue la vacuna, estoy esperando poder vacunarme y que mi familia también. Pero hasta que llegue eso en unos meses, tenemos que seguir haciendo todos los sacrificios que hemos estado haciendo. Digo también que durante todos estos sacrificios me he acordado de un poema en inglés de Carl Sandburg sobre la ciudad de Chicago, que la describe como una ciudad de hombros fuertes que carga a todos. Y creo que todavía tenemos mucho que cargar y ustedes y nosotros tenemos que seguir haciendo lo que hemos estado haciendo en los últimos meses. Muchas gracias.